Now, another thing that is trying to help save lives here is the needle exchange. I know that's been a hot topic.
Yes.
Can you explain from the health department standpoint what the goal is behind this? What is the aim to do?
So the needle exchange program is pretty controversial.
Yes.
It's very controversial,
Yes.
and it has been. It's kind of died down a little, but
Yeah, it ebbs and flows.
Yeah.
You know? But a needle exchange program is just, it's harm reduction. It is a public health policy to reduce disease and death for behaviors that happen. So when we have someone sadly using needles to shoot up their drugs, they share those needles. And in 2016, our hepatitis rates were, for Carbon-Emery and Grand, had risen to 57, and our HIV went to 6. Now those numbers should be lowering, not rising. So you can see that a community like ours, with 51% of the opiate overdose death burden in the whole entire state,
So,
needs a program to address harm reduction.
sure. I was going to ask you when we were talking about opioids a few minutes ago. I heard, and I don't know if it's true or not, that Carbon County is #1 in the nation, not even in the state, but in the nation, Carbon County, for opioid death.
Well,
Is that true, or is that not true?
Again, it ebbs and flows.
Okay.
We're comparable.
Okay.
And there are times when we are at the highest rate of it.
And that's
We're
based on-
higher than West Virginia or Kentucky. GQ Magazine called us last month to talk to us about our opiate deaths and what we were doing about it as a community.
And that's not based on the number of deaths, it's based on the number of deaths per population,
Yes,
is that
per
accurate?
population,
Okay.
yes,
per-
yes.
So,
So we're losing too many people who don't have the opportunity to go into recovery. So another one of the things that we were able to do when we wrote for the opiate grant was to purchase Narcan, to educate the community and to give that out. So we've given out Narcan to Helper, Price, Emery County. We're trying to schedule a meeting to go into Moab. Because Narcan saves lives, and I'll give you 2 examples that come off right off the top of my head. We had a little 16-year-old girl that overdosed, and they were able to give her Narcan, and it saved her life. And then in June, we had a 22-year-old man overdose, and they were able to use Narcan on him, and he went to work the next morning.
wow.
So you can't recover if you're dead.
No, you can't.
And recovery is possible. And one of the things with the needle exchange program, it's not just simply a program to exchange needles. With our needle exchange program in Utah comes education and HIV and hepatitis C testing.
Yes. So there's testing. They're also helping to connect with resources
Yes.
so that people, if they're ready, can
If they're
get
ready.
help. And so it's not just, hey, here's everything you
Right.
need. It's kind of trying to go beyond that.
But tell us, so the needle exchange program that was presented here from the coalition,
Utah
the
Harm Reduction
Reduction
Coalition,
Coalition, is not necessarily an exchange. You can come in and get the package without exchanging needles. Is that correct? I mean, I want to set the record straight because we've
So,
had a lot
Of different,
Uh-huh.
so it is,
So do they have to exchange a needle to get the package? Do they have to bring in dirties to get cleans?
they're supposed to, yes.
But
yes.
if they don't, are you going to turn them away?
They do not turn them away, no.
They still give them clean
do
needles.
And what
turn
do
them
they
away.
give them? What is all involved in what
Well,
is
and that
given?
just depends on what their funding allows for. So, of course, clean needles, but with that, and this is the controversial part, is what they call the kit.
Yeah.
So what they want to do is, keep in mind, we want to reduce hepatitis C and HIV. And I hope when I spoke earlier, I didn't say HIV 57.
You didn't.
Oh, okay,
No,
good.
you didn't.
I'm like, well, that's way too much.
Six.
And
Yeah.
hepatitis
Six
C,
is
yes.
frightening enough.
It is
that-
frightening,
so-
yes. So the intent is to reduce that. So the kit that they use, that people who inject drugs use, it leaves traces of blood, and in that blood trace is where HIV and Hep C is transmittable. So they offer them a clean kit, so that they're not sharing those things. Does that make sense? But with the Needle Exchange Program, they're a nonprofit organization, and a lot of what they are able to provide, other than education and testing, is dependent on funding for them as well.
So tell us, I know I keep asking the same question, but if I'm a user and I come into you and I say, I want a kit, I need a kit, I want a clean needle, I want to try to, is there such a thing as using responsibly? I know that one of the phrases that was used when it was presented was we're going to teach people to use drugs safely. Is that?
I know, and that's so controversial.
Yes,
like that.
it is. It's, I mean,
But the
really.
thing is we,
But I
attach a moral value to it when
Okay.
it's not a moral value. It's a health issue. It's to reduce harm reduction associated with drug use.
Sure. So I come to, and the health department is not giving these kits
No.
out.
No.
It is the
The
coalition, the harm
coalition.
reduction coalition.
We
So I
promote
go-
it because it's a public health policy, much like immunizations. If you think about immunizations, there are many people opposed to immunizations, but immunizations reduce disease and death. So it's something that we do.
Okay.
Same with the needle exchange program. The health department does not do that program, but
But
of
you help
course,
promote it.
it's a public health
Yes.
format.
And
It's
I
it's part of our public health policy.
Well, CDC came in and did a study, and the next counties that are slated for an HIV and hepatitis C epidemic are Carbon, Emery, and Beaver. That's the biggest reason we try.
To promote
promote
these
it.
programs, yeah.
So that we can be upstream with prevention instead of downstream.
So
with it.
where does so I'm a user and I come to and you may not be able to answer this because you're not implementing the program, but I go to the coalition and I say, I need a kit, I want to use responsibly, I want a clean needle. Where does the education come in? What do they offer? At the point that I walk in, I don't have any dirties to give you back. I just
So-
want some clean ones.
They offer you education.
In the form of what?
Well,
They give you pamphlets or they tell you
sure,
where
they
you
give
can
you
go?
education.
What is it
and
that they give?
This is one thing that the Utah Harm Reduction Coalition has that we've really not had for quite a while in all of our communities. They have access to available beds. So if you come in and you're a drug user and you'd like to go into rehab, they can facilitate that for you. They do HIV and hepatitis C testing so that you know
Okay.
where you are. And a
Do
lot-
I have to ask for that or are they going to offer it?
No,
No.
they mandatorily, they offer that. You don't
Okay,
ask for that.
immediately. And when I walk
Immediately.
in there and say I'd like a kit, then they're going to say, okay, that's fine, but here's
Here, let's
here's
do this first.
We need to.
Right,
Okay.
you know, and our legislation was pretty comprehensive when they created that law to make sure that we're just not handing out clean needles, that education is a process for that. And where else are you going to have someone one-on-one tell a heroin addict,
Sure.
listen, we have a bed for you when you're ready. You know, even families, we don't do substance abuse at the health department, and we get a lot of phone calls from family members, where can their loved ones go?
Yeah.
You know,
How do we help them?
we don't have a resource other than to facilitate a phone call for them. So I think that's a pretty unique feature for the Utah Harm Reduction Coalition to be able to say, listen, we can get you into a
Right.
bed.
Well, I'm certainly glad you kind of helped clear the air
Yes,
about that a little bit
yeah.
and explain what it all entails. It's not just here's all this stuff so that you can use
Yeah,
it.
go on your way.
It's very
Yes.
multifaceted, and there is a reduction point of view from it. It's not just to aid a different epidemic.
And that's
So-
where the controversy comes in. So many people attach a moral value that say, well, you're promoting drug use.
Yeah.
But what we're promoting is harm reduction because of drug use.
Great.
Sadly, drug use has been around forever.
Yep.
It probably will be around forever unless we're amazing at our prevention programs. So let's reduce the harm that's associated with that drug
Yeah.
use. I don't know about you, but I don't want to get Hep C.
Yeah.
You know, for picking up a needle. And this is one of the things that the harm reduction does. They come in and they clean up those sites.
Oh. You know, we should have them come and talk about their program.
Yeah.
Yes, that
Yeah.
could fill a whole nother show.
Yeah,
So
and
thank
that-
you,
that would be
ladies, for
wonderful.
joining us
And thank you for all the
explaining
work
that. Yes,
that
thank
you guys
for
are
the work
doing in
you're
the
doing.
community.
Thank
You're more
you,
than
guys.
welcome. Thank you for having us.
Okay. And thank you for joining this episode of Inside Eastern Utah. We will be back later this week with some more stuff that's happening here in our part of the world.
Right.